And our challenge across the board in the next few weeks will be dealing with high numbers of people who are off ill. And that may mean off work or out of school. It means out of healthcare. It means healthcare workers and educators who aren't able to go to work because they're ill. And for most of us, thankfully, because of our vaccinations, that will be a mostly mild illness. But the interruption to our business continuity is something that we now need to think more carefully about. And today I want to speak to businesses in British Columbia. Given this rate of transmission, the short incubation period, and the high number of people who are getting ill, we need now all businesses to put contingency plans in place to keep businesses operating when staff are off ill. At this point, given the number of people getting sick every day, we need to reactivate those COVID-19 safety plans. Those were the layers of protection specific to your business that allowed you to operate safely. We need to anticipate that as many as a third of your workforce at any one time may become ill with COVID-19, and they may not be able to come to work. And we need to adapt businesses so we can operate at these reduced numbers. Whether you're a private company, a school, a frontline business, or a healthcare site, now's the time that we have to prepare. It's not about public health orders and us telling you what to do. This is about activating all of those layers of protection available for your business in your situation to keep you from having to shut down because you don't have enough people to operate. So what do we need to do? First, remember, it is not just one thing. It's not about a rapid test. It's not about a mask that keeps one safe. It's about doing everything we can, all of us taking these measures to protect employees, our customers, and our family and friends. Every layer of protection is not 100% effective. It's putting these pieces together that gives us the protection that we need to keep operating. So what we need to do to prepare? Anyone who can work from home, you should be able to do that. Give employees and customers the space they need to stay safe. Remind and reinforce the need to keep that distance from people. Have fewer people in the same location at once, whether you can stagger shifts, stagger start times and breaks, making sure that staff are not all eating lunch in a small, unventilated lunchroom together, using those barriers, plexiglass barriers, limiting the numbers of customers in a space at any one time. Using appropriate PPE protocols. Ensure you have well-fitting, comfortable three-layer masks and having the ability to do things like washing your hands regularly. And, of course, vaccine requirements. These are important. We know they're in place in many employment opportunities, but requiring employees to declare their vaccine status so you understand the risk in your employees. And while vaccine right now won't stop all of us from getting infected with Omicron, it does significantly reduce the likelihood that we're going to have severe illness and be off for longer. It means that we can come back after that shorter 5-day isolation period. And it means that long-term recovery the risk of having long-term symptoms is reduced.